record. We're recording. So we also are operating in Connecticut as well. We don't have an office in Connecticut yet, but we are supporting some school districts and families in Connecticut. We offer remote supports as well, but we offer mostly hands-on supports. We have a sister company of Giving Hope in Michigan as well. And we're out here growing to build supports for people who are on the autism spectrum, but we're also working to support the whole person, and we don't just focus on autism. However, autism was the start in 2015. By education, I have a master's degree in school psychology. I have a doctorate in clinical psychology, board certified in school neuropsychology, and I practice in neurofeedback. So that's neurophysiology, and we do brain mapping and support in neurostimulation as well. It just helps to aid in the process of making progress in the absence of medication because I'm not a proponent of medication. So we'll get started. Let me get the PowerPoint up. And so I will let you know that some of this is going to be structured and some of it is going to be unstructured. The PowerPoint is much longer than 30 minutes. So I would like for you guys, tune in and then subscribe to our social network, which is a free platform. It's like a Instagram, but it's only for clinicians and people who need supports who suffer from autism or who need mental health supports and all of the other areas where we provide support. So I'm going to share my screen. We're going to get started, and we're basically going to talk about autism, understanding what autism is, understanding who suffers from autism, break down some of the misconceptions of autism. And I really want you to understand who suffers from autism and how to help people with autism. Sometimes we see people who are on the spectrum and we think that they are withdrawn, and that means that they don't want to interact. But 9 times out of 10, people who are on the spectrum, they want to interact. It's just something that is in them and within their brain. It's a neurological disorder that prevents them from interacting. So autism is a social communication disability that prevents them from interacting the way a typical person will interact, but they do want to interact. So please keep that in mind when you are interacting with a person on the spectrum. And the word that God gave me yesterday was grace when I was parenting my child. So grace, and patience. It's hard, but we do have to have grace and patience. So let me share my screen. Bear with me. Share screen. Oh, there it is. The green button. And I'm just going to spend my whole screen. And so this is from a curriculum that I put together, actually. So it has my picture in it. It's actually a video. But I'm going to put it in PowerPoint mode, and it's not going to speak to you. I'm going to do the speaking. So as you can see, I'm not savvy in this area. Okay, so I'm just going to turn the page. Okay, so understanding autism. So I'm going to click on it. So it used to be that I dislike when people say autistic, like terms of person autistic, because that means you're you're labeling a person the disability, and that's not what they are. They are a person with autism. So autism is a spectrum. Autism is a social and communication disability, and it is a neurological disorder. What typically happens and what we're seeing is it's not in vitro when a person is pregnant, but it happens after birth, that almost a traumatic brain injury happens with a baby or a child. And it usually happens around 18 months or 2 years. Before 3, we're able to diagnose a person with autism. However, for girls, it looks a lot different. So autism individuals, they share a common diagnosis, but the ability to adapt and their level of severity is different in terms of their cognition. And cognition is their ability to problem solve, their ability to reason. And that's why it's a spectrum. So you might see a person on the autism spectrum who is completely severe, and you might really identify that person as being on the spectrum where they're completely nonverbal, where they will not look at you when you call their name. They might dart and not understand, like run from you in public across the street and not understand danger. They might not understand directions when you give them directions. They might need supports with using the restroom. And they might just really have a hard time in all areas of life versus, and that's a level 3 versus a person who is a level 1. And we would consider that before 2015 Asperger's, and Asperger's is no longer a diagnosis. A lot of people don't know that, but Asperger's was actually taken out of the DSM, and it's now considered autism spectrum level 1. So this is a person who cognitively, they can do things that they're geniuses intellectually, cognitively. They can solve problems that I can't solve and many people can't solve. But in terms of communicating, when you speak to them and want to engage in the ebb and flow of conversation, they have a hard time with the back and forth. They might be able to answer one question and stop. And, typically when you're engaging in a conversation, you expect for a person to give you something more. You expect for there to be a back and forth and even exchange. But a person on the autism spectrum, a person with Asperger's will be very intelligent, but they have a lack of social intelligence. So they don't know how to go back and forth in conversation. They have a hard time in terms of their frontal lobe here. All people on the autism spectrum have challenges with their frontal lobe and their executive functioning. So that means they have a hard time with mirror imaging and their ability to understand socialization. So that would look like them looking at you and understanding your social cues, looking at you and understanding that you're happy, looking at you and understanding that you're upset when something makes you upset. If you say something so if they can't understand your facial expressions, your emotions on your face, they will have a hard time understanding jokes and understanding other social exchanges. And that would be a person who has Asperger's. And it's not that they don't want that, it's that they don't have the ability, and they have to be taught. It has to be broken down into smaller pieces for them. So that is the spectrum of autism, why it's called autism spectrum disorder. This is just talking about the difference between the DSM-4 and the DSM-5. So it used to be autistic disorder. And so there was PDD-NOS. So here in New York, if a child looked like they were on the autism spectrum, and we saw that they were on the fence, they had some cognitive capacity, but they still didn't give eye contact when you call their name. They still didn't follow one-step commands. They might have turned in circles. They may have flicked the lights on and off and looked to the side and line things up. But at the same time, they could problem solve and reason, and they could laugh some of the time. We would consider a child like that, and they could use the bathroom on their own. That would be considered a child with PDD NOS, not otherwise specified. So this would be a child who have a higher cognitive capacity, but is not so severe. So I don't know if you guys can see this. My screen is small, but this is just explaining how level 3 is consistent with autistic disorder. Asperger's is consistent with level 1 down here. I want you guys to understand that. And PDD was the umbrella of autism spectrum disorder. So what do we see in autism? Stereotyped or repetitive motor movements. You might see someone, flickering their hands. You might see someone rocking back and forth. You might see a person who is really restricted in how they like to do things. They want everything in order. They like the same foods. They might want to wear the same thing. They need consistency. They need their schedule to be consistent. They need to know where they're going. They need to know if there's a change in their schedule, and they're very rigid with their thinking. And it's hard for them to transition from one thing to the next, okay? And I'm not going to be able to go in detail, unfortunately. So we also see a lot of sensory issues in people and children on the autism spectrum. And it still is thought that boys are diagnosed. There are more boys. Autism is more prevalent in boys. However, what we're seeing now is girls are being diagnosed later in life. And why is that? My theory is that boys are more expressive physically. If you look at a little girl, a typical little girl and a typical little boy, the little boy is going to be bouncing off the wall. The little boy, a 2-year-old or a 3-year-old. And just look at them. Go to the park and look at a typical little boy and a typical little girl. The little boy is going to be jumping off of everything high. He's going to be, in my experience in working with children, he's going to be doing cartwheels. He's going to be doing everything risky physically. A little girl is going to be less risky. She's going to be less physical than a little boy. And we're seeing autism later in the teenage years show up. We're seeing it diagnosed in teenage and the early 20s for girls on the autism spectrum. So it's showing up in girls, but it hasn't been caught because the girls are not outwardly expressive like the boys. Unless it's a level 3 or a level 2. So what is taught is that there's no known cause for autism. It is a neurobiological disorder, and there's a genetic component. However, we have seen that there are, so when I do my evaluations, and I've done many evaluations, and I have overseen many cases of children on the spectrum over the last 15 years. And I take data and I ask, so when did your child change? When did you notice a difference in your child? It's always almost, I was going to say 90% of the time, when there was a vaccination paired with a high fever. when there were multiple vaccinations given paired with a high fever, this is when the parents have noticed a change, 90% of the time in my experience. So I just want to make it very clear that it's my experience, and it's been consistent with some of my colleagues. And I work with people who work with children on the spectrum. So I am only sharing my experience. So what we see in the neuro world, and I'm part of a group called the Neuro Tribe, we see that what happens is the fever actually swells the brain, and then the brain changes. And that's what causes the change in the person and how they are responding. So I suggest to ask the doctor about the fever and how to prevent the fever. And I'm from the South, so we use remedies like putting onions on the bottom of the feet to pull out the toxins from the body. But that's not a CDC remedy. That's a Southern great grandma remedy. So what are some of the behaviors that we see in people on the spectrum? And it's not just children, it's people. Oh, did someone say something? Okay, so we see that they have social difficulties, of course. They have a hard time with expressing themselves. They have a hard time with understanding, building, and maintaining relationships. The theory of mind, understanding that another person has a difference in opinion, has a difference in reasoning, has a difference in what they like. They just have a hard time being able to grasp this, and it has to be broken down into small pieces for them in order to understand it, and it has to be repetitive. And a person has to take their time with working with them to understand this, whether they are 2 years old, 22 years old, or 42 years old, or 52 years old. A person with autism will need the support of a person to understand that I don't know what you are feeling. I don't know that you think differently than I think. Like what I think is what everybody is supposed to think. It's not a thing of arrogance. It's just that their brain is wired differently, and they need the support of understanding that you think differently than them. So their sensory processing difficulties, they might need to take out the tags from their clothing. They might need for there to be like my wall right here has a lot of items on it that keep me focused. They might not be able to see that. It might be visually overstimulating for them. They might need for there to be white noise instead of a lot of noise. They might need noise cancellation earphones. I do have clients that cannot go into loud places. They might need to know how many people are going to be there and if it's going to be spaced out. And they might need to know where the exits are in working with them to even go inside of places that are outside of their home, because it's uncomfortable for them, excuse me, and it's different for them. When it's an unfamiliar place, it's a sensory situation for them, and it's uncomfortable for them. So those are things to take into consideration, and they don't really know how to express themselves in those situations. And executive functioning, challenges with their executive functioning. So I talked about the frontal lobe, and the executive processing happens in the frontal lobe. And executive functioning is getting started on tasks, the ability to get through tasks, expressing, working through tasks, finishing tasks, understanding your emotions, being able to accept change. That's part of executive functioning, being able to express your feelings when your feelings arise. So because they have challenges with executive functioning, they may get aggressive when they feel something and they can't really express themselves. They may have a tantrum because they have a challenge with controlling their impulses or not being able to express themselves. That is a challenge with executive functioning, and I'm gonna areas of difficulty. So they do have the black and white thinking. There's like no gray, there's no in between. Challenges with attention and motivation. You really have to find a potent reinforcer for them. And whenever you find a reinforcer that's potent for them, you want to only give them that reinforcer, give them access to that reinforcer when you're working on a task that they need to be motivated for. They only need to be exposed to that reinforcer that motivates them when they need to be motivated, no other time. If they are exposed to that reinforcer any other time, it will lose its value. They don't have understanding of hidden social rules, just like they don't understand your feelings when you may express it on your face. Like a lot of times they don't even understand when you're happy if you express with a smile. So that would be a challenge. Understanding hidden rules, obsessive interests. They might find a focus on trains and they need to watch the trains over and over and over again. You want to, and they might watch the same YouTube cartoon over and over and over again. If you have a child on the spectrum, I'm going to tell you to please don't let your child watch the same YouTube or the same cartoon over and over and over again, because their brains are so amazing. And what happens is they perseverate, they learn the show, they perseverate on the show, and they subverbalize. They will speak, it's not echolalia. When you're speaking to them, they will speak what the show is saying in the context. They might repeat it in the right context, but they're repeating what the show is saying instead of what they should be saying typically. And sometimes they will replay the show in their minds. And I'll give you before I wrap up, and I'm going to go through as fast as I can, but I will give you my example of a person on the autism spectrum. Think of a hallway and think of the living room. And the hallway is dark and the living room is the light where all the family gathers, right? So say we're having Christmas or a family gathering and there's light. A person on the spectrum, if you leave them alone and it looks like they want to be left alone because they don't know how to engage with others, and a lot of family members don't know how to interact with them. So they typically will give them an iPad or something and let them be off alone. The more you allow them to disengage, the further back they go into that dark hallway. And the longer they stay back in that dark hallway, the harder it is to bring them back into the light to interact with people. So as much as possible, you want to keep them out of the dark hallway and interact with them. You want to engage with them. You don't want them to, you want them to come to you and ask you for things, even if they can't speak. You want them to come and tug on you and utilize you for support. You want them to engage with you and not use you as an inanimate object, because some people on the spectrum you will think that they're using you as an inanimate object, but you want them to understand that you are a person and that they need people, and you want them to engage with you as much as possible. And that benefits them in being able to socialize. So that some of their behaviors are their obsessive rituals, their compulsive mannerisms, self-stimulatory behaviors, refusals, withdrawing, we just spoke about that, self-injury and abuse, and that comes from them not being able to express themselves, and then they get executive functioning, and then their inability to communicate. So I'm going to, let me see, sensory difficulties. They do have challenges with sensory difficulties, and people don't always understand it. And some of their sensory difficulties can be, let me go to that page. It can be visual, and I did touch on this, the olfactory. So sometimes even perfumes can set them off, even different tastes, and how they understand their body in space. That's proprioceptive, auditory, we talked about that, and then different textures as well. So I'm going to, let's see, what's the next one? So as a result of these sensory difficulties, individuals may experience sensory overload and then meltdowns as well. And people don't understand how to work with them. But if you pay attention and you introduce things slowly to them, you will learn your child, your family member, and what their needs are. But just have grace and patience, grace and patience. So I'm going to end there because of time, and I'm going to thank you, and then I'm going to open the floor for questions. And I'm going to say, because of time, all the questions will not be answered, but I want you to ask all of your questions here, and I will post all of the answers. I will do a video of all of the answers and post them on our www.social.givinghopellc.org. And it's just something like Instagram, where we share a lot of information and interact with people to support them in all of the platforms that we provide support in. And then we'll send everybody a survey, and you just let us know how we did. This is fast, it's 30 minutes, and our goal is to get our name out there and to support in the best way that we can. And I'm ready for questions. So we have 3 people. Oh no, we have 3 people in the waiting room. Oh no. So I'm ready for questions. If anybody has questions,
Hi, thank you for the great talk. I do have a question. Can you hear me well?
Hold on, let me stop sharing my screen so I can see you as well. And for the people that I just let in, I'm so sorry. I didn't know.
It's fine. It's fine. You can still have the slides on, because like I'm like kind of look messy now, so prefer
okay, good.
Not to show my face. Sorry. Okay. Yeah, but yeah, thank you for the great talk, and I enjoy listening to this talk. And I do have a question. It's more about the Giving Hope, your organization. So you briefly mentioned what you do, but I wonder, so when you say practice, do you mean you have people who are trained in like ABA to do practice at home with children with autism, or what kind of practice you do?
Okay, yes, we do. And what I'm going to do is, just for the sake of time, I'm going to let everybody ask their questions, right? And then I'm going to respond to everybody's questions in a video, but I'm going to post it on social.givinghopellc.org. And then I will connect everybody that is here to that. So I will thank you so much for your question. But yes, we are trained in ABA. We do have clinicians trained in ABA, and I'll give you more information in a more detailed response. So are there any more questions? Okay, so since we don't have any more questions, I can answer your question more in detail. So what we are in the process of doing is what I've seen over the years, and I've worked in the home since 2007 in providing ABA therapy and supervising clinicians in ABA. And what I saw was that there was a breakdown in supports of these children, and we're providing evaluating the child and then evaluating every person in the home in terms of what their needs are in order to support that child. So we're providing in-center therapy and in-home therapy for that child. but we're also providing services to the family members as well. So that's the service model that we are delivering here at Giving Hope. So we also provide other supports. We have an MD on our staff, and so autism also affects the serotonin levels, and serotonin are neurotransmitters in the brain, and that affects your. I'm giving y'all a lot of information. So serotonin impacts your mood, and serotonin impacts sleep. And so we are monitoring the blood levels of children and people on the autism spectrum, because we want to make sure that if their sleep is being impacted and their moods are being impacted, that it's not because of their imbalance, their chemical imbalance. So that's another thing that we are supporting families with as well. So we're supporting the whole entire child and person. So I keep saying child because that's our start, but we're supporting the whole person, autism spectrum from birth throughout the whole life. And we provide advocacy services and what else do we provide? Evaluations and trainings. We do provide family therapy as well.
Thank you so much for answering my question. Those evaluation and serotonin, and I follow the person for the whole lifespan sounds very awesome. Thank you so much.
It's my pleasure. It's my pleasure. Any more questions before we go? Well, I'd like to thank you all so very much for your time. I appreciate you. We'll be back the next first Thursday of next month, and we'll have a different discussion on autism with more information. Okay, so I'll send you guys out some more information on our company and some more support. And if you're interested, subscribe and share the information. And oh, I didn't tell you guys, make sure you follow us on also, if you create a reel, I'm not sharing my screen, oh shucks. If you create a reel on Instagram, if you don't know how to do it, you have to ask somebody that's savvy. But if you create a reel and hashtag, make sure you connect Giving Hope LLC and hashtag Giving Hope LLC and hashtag autism awareness. Whoever has the most likes on their reel in the next 7 days will get a free hour session with consultation with myself. So figure out how to create a reel, and it has to be about this presentation, and like make it fun and whatever you felt about this presentation, what was needed, what was not needed, what you learned, something helpful, and whoever gets the most likes will get a free consultation. So thank you guys so much. God bless you and have a good night.